a senior home coach with Keller Williams Realty. And what that means is I help people in the 55 plus sector transition into their next home, whether that's a retirement community, it could be a one-level townhome, could even be a single family home. And the other thing I do is I like to educate the elderly population as well as the general public. So I have Dr. Duper here. She is an internal medicine physician at Mayo Clinic. And the first question I'm going to ask you, Dr. Dupra, is when should someone take supplements?
Thank you, Lori. And I want to say that I've been in practice in primary care internal medicine for the past 33 years. And the opinions that I offer today are those of mine alone, and they don't represent primary care internal medicine, the Department of Medicine, or the Mayo Clinic here in Rochester. So I want to be clear about that. This is based on my own experience and also the information that is available. I'm well versed in pharmacology and supplements, and so thank you for inviting me. So, the real issue about supplements is what are they intended to do? And supplements are really exactly what they say. They are intended to supplement diets. Now, there are situations where people do need supplements, and usually it's because they're deficient in something. For instance, if they have an anemia, they may need iron to supplement their diet because they're low in iron, which is required to build red blood cells. Most of the time, if people eat a healthy diet, they actually don't need vitamins. Now, the exception is for the most part, we often recommend women who are in the postmenopausal state, which is after their periods have stopped, should take calcium and vitamin D primarily for bone health. And we typically recommend at least 1,200 milligrams of calcium and 800 international units of vitamin D a day to try to preserve the health of their bones. And that would also be true for men, for instance, who might have prostate cancer and are on medicines to block the effect of testosterone, which is also something that preserves bone health. But generally, unless people are on a medication or have a specific deficiency, they don't need supplements. I would also add, though, if they do take supplements, we all know if you go to the store and you look at the shelf, there are a multitude of different supplements they
Oh,
might
yeah.
take.
Hmm.
So it's like, which one do I take? Do I take the cheapest? Do I take a specific brand? But I want to point out that there is an important label that they should look for, and it's something called USP, and that stands for United States Pharmacopoeia. And that's really a marker that this supplement has high quality. That means that what's in that bottle is what it says it is. It's the amount it says it is, and it's pure without contaminants. So if you buy a supplement for any reason, please look for USP.
Okay. Another question I have you are supplements safe?
Very good question. So we know that there are a lot of supplements and there are a lot of claims out there, and most of them aren't supported by literature. The thing I think that's very important if you decide you want to take a supplement, ask your healthcare team. I say that because if you're on some medications, some of the supplements can actually interfere. And one of the common things is if you're on calcium and you get prescribed an antibiotic, there can be an interaction where the calcium just binds up with the antibiotic and makes the antibiotic not work. Now, that doesn't mean it's unsafe, but it does mean it won't be effective.
Hmm.
There are other situations where some supplements, especially if taken in large amounts, aren't safe for you. And some of them that are out there are things like kava kava and other compounds that really taken in high doses can lead to problems. Most commonly, it can affect your liver. So it's important that you actually ask your healthcare team, can I take this? Is it safe? And can I take it at the levels or doses that I want to take it?
Okay. Prevagen. I know a lot of people see that on the commercials, and of course, that's where I've heard of it. And they advertise it as it's good for the brain, that it can help with dementia. And it's a big concern of mine because both my parents had dementia. Does that work?
Really good question. And if you look at who takes supplements in the surveys that have been done after the age of 60, 75% of people are taking supplements. And when you think about brain health, AARP actually did a survey back in 2021, and they asked adults over the age of 50 specifically about taking something for your brain. And actually, a quarter of patients or a quarter of the people they surveyed were taking something for their brain. And they took all different things, and the data out there, when you look at it scientifically and say, does it matter, does it help, and nothing has been proven to help
Hmm.
with brain health. The only thing that really has been shown to make a difference actually is exercise. And when you think about it, when you exercise, you increase blood flow to the brain, and the very most important compound or drug for the brain is oxygen. Now, specifically to Prevagen, there has been a huge campaign in advertising that Prevagen is helpful. And actually, when I've looked specifically at the study that they did to ask about Prevagen, there's actually no scientific evidence that it actually does anything. And a quote from the study that was published says, there's no statistically significant results that were observed over the entire study population. So, frankly, it doesn't work.
Hmm.
And there actually was a lawsuit that was
Darn.
brought in 2017 by the Federal Trade Commission and New York State Attorney General that charged the makers of Prevagen of making false and unsubstantiated claims. So when my patient says, should I take Prevagen? I say, really, you're not spending your money wisely because it doesn't work.
Mhm.
It does not help your brain.
One of the things that my mother used to do all the time because her mother had Alzheimer's and she encouraged us to do is crossword puzzles and word search and puzzles. Does that really make a difference?
I think that if you talk to the people sort of in our behavioral health or our neurobiology group, they would say yes. Keeping your brain active, challenging it, doing those things is never a bad thing. Will it prevent Alzheimer's? No. But even in people who are having some mild cognitive impairment, which isn't Alzheimer's and isn't dementia, those brain activities, keeping your brain active, is a really important thing to do for all of us. Puzzles are an excellent way to keep the brain doing things. Active, not passive. Watching TV doesn't work, but challenging your brain with crossword puzzles or word finding activities are always good things to keep your brain active.
Okay. Is there something else that you would like to add before we conclude the interview?
Thank you. I think the important thing to know is supplements have a place in healthcare, especially when there is a specific deficiency. I think if you have a question, should I be taking a supplement? The most important thing is to talk to your healthcare team. And if you do have a deficiency, in particular, if you're on medications, you should ask. But the other important message is many people take things and doctors may not ask you, are you taking any supplements?
Mhm.
Are you taking turmeric? Are you taking a bunch of high dose vitamins? Please tell your healthcare team about those because sometimes there can be significant side effects. My mom had unexplained diarrhea for months, and it was because she was taking turmeric. And I had a patient who underwent hundreds of thousands of dollars of a workup, and it turned out she was simply taking high doses of something called turmeric to help with her joint pain. So tell your doctor, tell your nurse practitioner, tell your physician extender what you're taking that's not a prescription drug because it may matter.
Okay. Anything else?
No, I just thank you for the opportunity to talk about
Oh,
supplements.
I thank you.
And I hope you have a great day.
You as well. Take care.
You too. Bye now.
Bye.